Hi, I'm Elaine Vickers and welcome again to my video series on cancer treatments. In this video, we're diving into targeted therapies. Now, there's quite a bit of confusion about what does or doesn't count as a targeted therapy, which makes it a bit tricky to talk about them. So I'm actually going to begin with what targeted therapies are not. Targeted therapies are not chemotherapy. Chemotherapies are typically small chemical compounds. Many were originally discovered in plants or trees or even created through industrial manufacturing processes like chemicals developed to dye fabric. Over the years, scientists have tested thousands of these compounds to see if any of them could selectively kill cancer cells. In many cases, these drugs were discovered by chance and developed through a trial and error process. Our understanding of how they worked was worked out later. Targeted therapies, on the other hand, have been developed in a completely different way, most of them at least. When scientists set out to create a new targeted therapy, they start by identifying something that's essential for the survival or growth of cancer cells, but that is missing from or is unimportant to healthy cells. Once they've found a potential target, they try and work out a way of blocking it. Almost always, the thing that fits the bill as the target is a protein. Now, if you're not quite sure what a protein is, I'd recommend checking out my Cancer Basics video series, where I describe how cells use their DNA to create thousands of different proteins that control their behavior. Our cells are packed with thousands of different proteins in the cytoplasm, in the nucleus, on their surface, and each protein is performing a specific job for the cell. In cancer cells, mutations in their DNA are forcing them to make faulty proteins, but it's a tricky task to work out which of these faulty proteins is forcing the cells to multiply, telling them to stay alive, or controlling any of their other faulty behaviors. The sorts of questions the scientists will try and answer are things like, how important is the protein to cancer cells? Do the cells die if you block it? If so, then it might be a good drug target. But they will also want to know if it's found in healthy cells too, and if so, are those healthy cells depending on it as well? Because if they are, then it's not such a good target because you're going to see lots and lots of side effects. They'll also want to know if the target they've identified, is it in all of the patient's cancer cells or just some of them? If it's only in some, the drug won't be that effective. They also want to know if the protein is mutated and overactive in cancer cells, or is there just more of it than normal? Usually, mutated proteins make better targets. And lastly, is the protein we've identified, is it something that we can actually target? There are a lot of things we can't do anything about. We can't target them, and we have to be realistic and stick to the proteins we can actually do something about. By the way, if you like my teaching style and want some education for your team, then please do get in touch. There are links in the description below. There are really only two groups of proteins that scientists have become really good at targeting to create new cancer treatments. These are things sticking out from the surface of cells and kinase enzymes. If something is sticking out from the cell surface, then the easiest way of targeting it is with an antibody-based treatment. And I've made a separate video about antibodies and how and why we use them as cancer treatments. I've also made a separate video about kinase enzyme inhibitors. There are still very few targeted treatments that block things that aren't on the cell surface and that aren't kinase enzymes. The list currently includes PARP inhibitors, which are helpful for some people with ovarian cancer and a few other cancer types, KRAS G12C inhibitors, mostly given to people with lung cancer, BCL2 inhibitors, given to some people with blood cancers. And there's a few other drugs as well, things like the proteasome inhibitors, HDAC inhibitors, and hedgehog pathway inhibitors. To recap, targeted therapies are different from chemotherapy. They've been deliberately designed to block a specific target, and usually that target is a protein. It's a challenging task to work out what to target that would make a useful cancer treatment. And often scientists begin by looking at the cell surface and looking at the kinase enzymes in the cell, because they've become very good at creating antibody treatments that target cell surface proteins and kinase inhibitors that target the kinase enzymes. Don't forget, if you enjoy my teaching style and you want some education for your team, then find me on LinkedIn or contact me through my website. There are links in the description below.